Aloha. Here's our daily COVID-19 briefing from Team Kauai for Sunday, March 29. We have had a total of 12 confirmed cases as of this taping. This is one more than we announced during yesterday's video update. 6 of those cases are still on the island, all are residents, and all are in home isolation. To view the total number of positive cases across the state, please visit hawaiicovid19.com. The daily count on this site is updated at noon every day. I'd like to speak more to the coronavirus response in a minute, but first I'd like to talk about yesterday's flood, which left many homes, vehicles, and personal property underwater. For anyone who experienced property damage as a result of yesterday's storm and flood event, please report that damage online by going to our Kauai Emergency Management Agency website at www.kauai.gov/KEMA and click on the button that says March 2020 Flood Damage Report. If you do not have online access or need further assistance, please call KEMA at 241-1800. Mahalo. We have seen an increase in numbers over the past 2 days, especially as it relates to our local residents. This is where we can be in danger of community spread. The virus is now in our community and can and will spread quickly if we don't control it. More specifically, if we don't control ourselves. For those of you who may not have understood the importance of staying at home, limiting outside exposure, keeping a 6-foot distance from others, and practicing enhanced hygiene, now is the time to get on board. We are responsible for our success at beating this virus, and by the increasing numbers, we know we have work to do. Please do your part to save our kupuna and those in our community who are most vulnerable. With the increase in positive cases among our residents, I understand that there will be an increased concern about community spread. So I've asked our district health officer, Dr. Janet Behrman, to speak to that today. Dr. B has been here in the EOC with us every single day, helping us to make decisions to help protect our community. We are so grateful for her guidance and dedication to our community. Thank you for being here, Dr. B.
Thank you, Mayor, for inviting me to speak. As the Kauai District Health Officer, my job is to protect the health and well-being of the Kauai community. These are challenging times for all of us, and I want to express my deep appreciation for everything that our residents are doing and that the Mayor's team here in the Emergency Operations Center is doing. We are all making sacrifices, some of us by working long hours every day to maintain essential services, and most of us by staying home as much as possible. Over the last 2 days, we've seen an increase in the cases on Kauai that's been quite dramatic. On Friday morning, we had 5 cases, and as of this morning, we have 12 cases total in our community. Some of us may be thinking, why should we bother with curfew and staying home and washing our hands when coronavirus is just spreading more rapidly than ever? But in fact, it's too soon for us to see the impact of the precautions we've taken over the last week or so. COVID has an incubation period of about 2 weeks. That means it can take as long as 2 weeks for somebody to get sick with this virus after they've been exposed to it. So the new cases that we saw in the last couple of days didn't happen this last week, but were the result of people who were exposed to this disease before the mayor and the governor put in place measures like our overnight curfew, the 14-day quarantine on arriving travelers, and the stay-at-home order. Those measures are powerful, and we will see the impact of those measures. But it will take 2 to 4 weeks before we see the slowing of the spread of disease. We'll only see that slowing, or the flattening of the curve, if we all act together to follow these powerful directives that are in place. We're at a critical juncture here on Kauai. With the increase in cases, we've seen an important shift. Among our first 5 cases, most of them were visitors to our island. Now, most of the cases are Kauai residents who are returning from travel to the mainland. When residents come home, we don't stay in hotel rooms and we don't just visit tourist sites. We go to our homes and greet our loved ones. We live, eat, and sleep in multi-generational houses, and often those houses are quite crowded. We like to be together. We can't avoid being together. But this puts all of us at greater risk. The rest of the state has seen the first cases of community spread of COVID-19. That means that some people on other islands have gotten infected without traveling anywhere and without being around someone who has traveled. They were infected by others in their community, unknowingly, but in their community. We have not yet seen community spread here on Kauai, and our actions can help keep it that way. Here are the things we can all do to continue to protect our island. Number 1, remember that stay at home means exactly that. All of us should stay at home as much as possible. That includes workers like us in the Emergency Operations Center with essential duties. We need to come to work, but when we're not at work, we should be at home. When getting food, caring for others, or exercising, each of us needs to spend as little time with other people as possible. The less interaction we have with others, the less opportunity we give this virus to spread from person to person. 2, if you're sick, even a little bit sick, stay completely at home. This is especially important if you have essential duties. The last thing you want to do is expose other essential workers. 3, avoid off-island travel as much as possible. Even travelers to neighbor islands pose more risk than people just staying at home. Mainland or foreign travel pose even greater risk. Remember that everyone who travels out of state must carefully observe the 14-day quarantine by staying at home at all times for those 14 days after returning. And 4, at all times, whether at home or at work in an essential function or when working from home, observe the basics. Keep a distance of 6 feet from other people. Wash your hands frequently and thoroughly. Cover your coughs and sneezes. Clean the surfaces frequently, and avoid large groups and gatherings. Finally, a word about testing. If you think you need to be tested for coronavirus, here are some things you should know. Being tested when you are not sick is not useful. Even if the test is negative, you could still become sick the next day, and having a negative test will not shorten the period of quarantine that you're in if you are in quarantine. You must call your doctor first if you want to be tested and discuss your concerns. If you need to be tested, your doctor will order the test. And after you have an order from the doctor, you should follow his or her directions about getting the sample obtained. While you wait for the result of your test, you must stay home in quarantine until you receive the results. If the results are negative, you're free to go about your business that is still mostly staying home. But if the results are positive, your doctor and the Department of Health will contact you with further instructions. Thank you all very much for everything you're doing to protect our community. Thank you.
Mahalo, Dr. Berriman. If you hear nothing else in today's video, please hear this. Act as though you are carrying COVID-19. Act as though others you encounter throughout your day are carriers of COVID-19. And then act accordingly to keep it from spreading to others. That means staying home as much as possible. Refrain from social gatherings or public outings. If you must interact with people outside of your home, keep a distance of 6 feet of separation. Do not leave home if you're sick, unless you are seeking medical attention, and then only after calling your doctor first. Wash your hands frequently and clean surfaces often. We're going to get through this, Kauai. Stay informed and connected during this time of social distancing. We'll continue to post updates on our official County of Kauai Facebook page or on our Kauai Emergency Management Agency page at www.kauai.gov/COVID-19. The Center for Disease Control is also updating its website regularly with detailed guidance related to COVID-19. For more information, please visit coronavirus.gov. Not everyone has internet access or follows the news, so please help to keep your loved ones informed. And last but not least, be kind. We can do this, Kauai. Take care of one another. God bless and aloha.